Did you know that more than 1 in 3 adults may be living with prediabetes, and most of them don't even know it? This silent warning sign of type 2 diabetes could be progressing inside your body right now without a single symptom. The question is, are you at risk, and what can you do about it before it's too late? Before we begin, the information provided in this video is intended for educational and informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional before making any changes to your diet, exercise routine, medication, or health management plan. Individual health needs may vary, and only your healthcare provider can offer guidance tailored to your specific situation. Prediabetes. Prediabetes is far more common and far more dangerous than most people realize. According to the Centers for Disease Control and Prevention (CDC), an estimated 96 million American adults, more than 1 in 3, are currently living with prediabetes. Even more alarming is the fact that over 80% of them are completely unaware of their condition. This means millions are unknowingly progressing toward type 2 diabetes, a disease that can lead to heart attacks, strokes, kidney failure, blindness, and even limb amputations if left unaddressed. What makes prediabetes especially insidious is its silent nature. Unlike overt diabetes, prediabetes rarely presents obvious symptoms. Without routine screening or awareness of risk factors, many individuals carry this metabolic time bomb for years, until irreversible damage has already begun. Yet here is the most compelling truth: prediabetes is reversible. With timely intervention through diet, physical activity, weight control, and medical guidance, the progression to type 2 diabetes can be prevented, or at least significantly delayed. But this requires awareness, early detection, and decisive lifestyle changes. Understanding prediabetes is not just important, it could save your life. Signs of prediabetes. Have you ever felt unusually tired after meals or noticed that small cuts and bruises seem to take longer to heal than they once did? These small, easily dismissed changes could be your body's early warning signals, signs that your blood sugar regulation is faltering, and prediabetes may already be developing silently within you. For many, the signs of prediabetes are so subtle that they are mistaken for everyday stress, aging, or poor sleep. Yet these clues, if recognized early, can make the difference between prevention and progression to full-blown diabetes. The most common signs include a persistent fatigue. When your cells are unable to properly absorb glucose for energy, the result is a lingering, unexplained tiredness, even after adequate rest. Increased thirst and frequent urination. High blood sugar levels pull fluid from tissues, leaving you feeling thirsty more often. As a result, you may find yourself running to the bathroom frequently, especially at night. A blurred vision. Excess glucose in the blood can affect the lenses of the eyes, causing occasional blurred or double vision. A slow healing of wounds. Small cuts, scrapes, or infections may take longer to heal due to impaired blood circulation and reduced immune response. Tingling or numbness in hands and feet. Nerve endings can become damaged even in the early stages of blood sugar irregularities, leading to mild but noticeable sensations in extremities. Unintended weight changes. Some individuals may notice unexplained weight loss or gain, which may be tied to metabolic changes in how the body processes sugar and fat. But here's the crucial takeaway: most people with prediabetes experience no obvious symptoms at all. This is why routine blood sugar screening, especially for those over 45, or with risk factors such as obesity or family history, is not optional. It's essential. Don't wait for obvious symptoms to appear. By the time they do, damage may already be done. Take control now. Ask your healthcare provider for a simple fasting blood glucose or HbA1c test. Early awareness could change the course of your health and your life. Causes of prediabetes. Have you ever wondered why some people can enjoy sugary treats or large meals without immediate health consequences, while others develop blood sugar problems so early in life? The truth is, prediabetes doesn't happen overnight, and it's rarely the result of a single cause. It develops silently over time, shaped by a complex interaction of genetics, lifestyle, and environmental factors. At the heart of prediabetes is a condition called insulin resistance. Normally, after you eat, your body releases insulin, a hormone produced by the pancreas, to help transport sugar from your bloodstream into your cells for energy. But when your cells become resistant to insulin's action, glucose builds up in the blood instead of being absorbed, leading to higher than normal blood sugar levels. Several factors can drive this process. Excess body weight, especially around the abdomen. Carrying extra fat, particularly visceral fat stored around the abdominal organs, increases insulin resistance significantly. This is why central obesity is a strong predictor of prediabetes. Physical inactivity. Muscles play a major role in sugar uptake. A sedentary lifestyle means less glucose is used for energy, promoting insulin resistance over time. Unhealthy diet. Frequent consumption of highly processed foods, sugary drinks, and refined carbohydrates contributes to weight gain and poor metabolic health, accelerating the risk of prediabetes. A genetic predisposition. Family history matters. If a parent or sibling has type 2 diabetes, your risk of prediabetes rises sharply. Age and ethnicity. The risk of prediabetes increases after age 45, and certain ethnic groups, including African Americans, Hispanics, Native Americans, and Asian Americans, are more susceptible. Other medical conditions. Polycystic ovary syndrome, PCOS, hypertension, and dyslipidemia, abnormal cholesterol levels, are all associated with an increased risk of developing insulin resistance and prediabetes. But perhaps the most dangerous cause is lack of awareness, because without knowing these risk factors, most people fail to take preventive action until it's too late. You can't change your age or your family history, but you can control your weight, your activity level, and your diet. Start with small, consistent changes today. Every step you take away from insulin resistance is a step away from type 2 diabetes. Symptoms of prediabetes. Have you ever dismissed feeling constantly tired, unusually thirsty, or experiencing blurred vision as just the stress of a busy life? These seemingly minor annoyances may actually be early symptoms of a more serious problem, one that millions of people unknowingly live with every day: prediabetes. The challenge with prediabetes is that most people experience no clear, alarming symptoms. This makes it a silent but dangerous condition, quietly progressing toward type 2 diabetes unless detected through routine screening. However, in some cases, subtle signs do appear, if you know what to look for. Here are the possible symptoms linked to prediabetes. Unusual or persistent fatigue. When the body cannot efficiently use sugar for energy, tiredness can creep in, leaving you feeling drained even after rest or meals. Increased thirst, polydipsia. As blood sugar levels rise, the body attempts to remove excess glucose through urine, causing dehydration and an unrelenting sense of thirst. Frequent urination, polyuria. The kidneys work overtime to flush out excess glucose, leading to more bathroom visits, especially at night. A blurred vision. High blood sugar can alter the shape of the eye's lens, causing temporary blurring of vision or difficulty focusing. A slow healing of cuts and wounds. Elevated blood glucose impairs circulation and weakens immune response, making even small injuries take longer to heal. Tingling or numbness in hands and feet. Known as peripheral neuropathy, this can occur even in the pre-diabetic stage, especially if insulin resistance has been present for years. Despite these possible symptoms, it's important to remember that most individuals with prediabetes feel perfectly fine, until the condition progresses to diabetes or other complications. This deceptive lack of clear warning signs is why many cases go undiagnosed. Never wait for clear symptoms to take action. Prediabetes rarely announces itself loudly, but a simple blood test can. If you have risk factors like excess weight, family history, or a sedentary lifestyle, talk to your doctor about screening. Catching it early can save you years of future health complications. By now, you might be wondering, could this silent condition be affecting you or someone you care about without knowing it? The truth is, prediabetes can hide for years without obvious symptoms. That's why early screening is not just important, it's essential. If you're over 45, have a family history of diabetes, carry excess weight, or lead a mostly sedentary lifestyle, don't wait for the warning signs to appear. Take control of your health today by speaking with your healthcare provider about a simple blood glucose or HbA1c test. Remember, prediabetes is reversible. The sooner you act, the greater your chances of preventing type 2 diabetes altogether. Diagnosis of prediabetes. Have you ever thought, I feel fine, why would I need a blood sugar test? This is exactly why prediabetes is so often missed. Most people with this condition feel normal, unaware that high blood sugar is slowly damaging their blood vessels, nerves, and organs. Without early testing, the first obvious sign might not appear until it's too late, when type 2 diabetes has fully set in. Diagnosing prediabetes is simple, fast, and can save you years of future complications. Healthcare providers rely on a few standard blood tests to detect this hidden threat. 1. Fasting plasma glucose (FPG) test. Measures blood sugar after you haven't eaten for at least 8 hours. O prediabetes range, 100 to 125 mg/dl. 2. Oral glucose tolerance test (OGTT). After fasting, you drink a sugary liquid, and your blood sugar is tested 2 hours later. O prediabetes range, 140 to 199 mg/dl after 2 hours. 3. Hemoglobin A1C test, HbA1c. Reflects your average blood sugar over the past 2 to 3 months. O prediabetes range, 5.7% to 6.4%. These tests are painless, affordable, and widely available. Yet despite their simplicity, millions skip this vital step because they feel healthy, or assume they're too young or not at risk. This false sense of security allows prediabetes to quietly progress until serious damage occurs. Don't let prediabetes remain invisible. A simple blood test today can protect your heart, kidneys, and nerves tomorrow. If you have risk factors or are over 45, talk to your doctor now. Early detection is your best defense against diabetes. Treatment plan for prediabetes. What if you could press pause, or even reverse, on the progression toward type 2 diabetes? Imagine learning that this silent condition you didn't know you had could actually be turned around with the right steps. The good news is that prediabetes is not a life sentence. It's a warning and, more importantly, an opportunity for change. Treating prediabetes does not always require medication. In fact, the cornerstone of managing and even reversing this condition lies in lifestyle modification, which has proven more effective than drug therapy in many cases. Here's what an evidence-based treatment plan looks like. 1. Weight loss. Shedding just 5 to 7% of body weight, that's about 10 to 15 pounds for someone weighing 200 pounds, can dramatically reduce the risk of developing type 2 diabetes. 2. Healthy eating patterns. Emphasize whole grains, lean proteins, healthy fats, like nuts and olive oil, fruits and vegetables. Avoid sugary drinks, refined carbohydrates, and highly processed foods. The Mediterranean diet or DASH diet are commonly recommended for metabolic health. 3. Regular physical activity. Aim for at least 150 minutes per week of moderate intensity exercise, such as brisk walking, cycling, or swimming. Physical activity enhances insulin sensitivity, reduces blood sugar, and helps with weight control. 4. Behavioral support. Participation in structured programs such as the Diabetes Prevention Program, DPP, guided by health coaches or dietitians, can significantly improve outcomes. 5. Medication if needed. In certain high-risk individuals, such as those with severe obesity or a history of gestational diabetes, medications like metformin may be prescribed to reduce liver glucose production and improve insulin sensitivity. However, this is usually considered when lifestyle changes alone are insufficient. 6. Monitoring and follow-up. Regular follow-up visits with your healthcare provider are essential to assess progress, adjust the treatment plan, and ensure sustained success in blood sugar control. Remember, prediabetes is reversible, but only with consistent, intentional effort. Your daily choices have the power to rewrite your health story. Start small. Swap sugary drinks for water, take a 30-minute walk, or prepare one home-cooked meal instead of ordering out. These steps, done consistently, can stop diabetes before it starts. Don't wait for tomorrow. Your best chance to reverse prediabetes is today. Implementation of a prediabetes management plan. Have you ever started a health plan, eating better, exercising more, only to find yourself slipping back into old habits within weeks? You're not alone. Turning knowledge into daily action is the hardest part of managing prediabetes, but also the most important. Implementing a prediabetes treatment plan isn't about sudden, drastic change. It's about making realistic, sustainable adjustments that fit into your life, day by day, habit by habit. This is how lasting health is built. Here's how successful implementation looks. 1. Set clear, achievable goals. Break the journey into small, manageable steps. Example, start with a 15-minute walk after dinner 3 times a week. Gradually build up to 30 minutes most days. 2. Meal planning and preparation. Prepare meals ahead of time to avoid impulsive, unhealthy choices. Stock your kitchen with high-fiber, low-sugar options like whole grains, vegetables, and lean protein. Use grocery lists to avoid processed, high-carb foods. 3. Daily routine adjustments. Incorporate movement into everyday activities. Take stairs instead of elevators. Park farther from entrances. Stand or walk during phone calls. 4. Self-monitoring. Track weight, waist circumference, or physical activity using apps or a simple notebook. Record food intake to spot hidden sugar or excess calories. Monitor blood glucose levels if recommended by your healthcare provider. 5. Accountability and support. O. Engage with support systems, friends, family, or structured health programs like the National Diabetes Prevention Program, NDPP. O. Share your goals. Accountability partners improve adherence. 6. Regular follow-up. Stay connected with your healthcare team for guidance, motivation, and plan adjustments based on progress. Implementation is not about perfection. It's about consistency over time. Even small changes, repeated daily, can transform your metabolic health. The best treatment plan is the one you can stick to. Start with one simple, doable change and build from there. Each small victory adds up to a life free from diabetes. Don't aim for perfect, aim for progress. Monitoring and follow-up in prediabetes management. Have you ever tried to lose weight or improve your health only to stop checking your progress, and before you knew it, old habits crept back in? This is exactly why monitoring and regular follow-up are essential parts of managing prediabetes. Without these critical steps, even the best treatment plans risk fading away over time. Prediabetes is not a set-it-and-forget-it condition. It demands ongoing attention to ensure that progress is maintained and that the risk of developing type 2 diabetes continues to decrease. Here's how proper monitoring and follow-up should be implemented. 1. Routine blood glucose testing. HbA1c testing every 3 to 6 months is standard for tracking long-term blood sugar control. Additional fasting glucose or oral glucose tolerance tests may be performed based on your doctor's recommendation. 2. Weight and waist circumference checks. Regular self-monitoring of body weight, ideally weekly, and waist circumference is important, as central obesity directly impacts insulin resistance. 3. Blood pressure and lipid profile monitoring. Since prediabetes increases cardiovascular risk, regular monitoring of blood pressure and cholesterol levels is essential to prevent heart disease and stroke. 4. Lifestyle assessment. During follow-up visits, your healthcare provider will review dietary habits, physical activity levels, and any difficulties in maintaining lifestyle changes. Adjustments are made based on this feedback. 5. Review of medication if applicable. For those prescribed metformin or other medications, follow-up ensures the drug's effectiveness, dosage adjustment if needed, and checks for side effects. 6. Support and education. Ongoing education and possibly referral to dietitians, diabetes educators, or structured lifestyle programs help reinforce the importance of adherence to the plan. Monitoring is not about perfection. It's about staying informed and adjusting the plan as your body responds and your life circumstances change. Progress fades without follow-up. Schedule your next blood sugar test before leaving your doctor's office. Track your weight, your activity, your meals, and celebrate small improvements. Regular monitoring keeps you in control, turning today's effort into tomorrow's healthy outcome. Prevention of prediabetes. Have you ever thought, "It won't happen to me, I feel healthy, I have no symptoms"? This belief is exactly why millions of people unknowingly slip into prediabetes every year. But the truth is, prediabetes and even type 2 diabetes is largely preventable, and the steps you take today could safeguard your health for years to come. Prevention starts with awareness and small, intentional changes that reduce insulin resistance and improve blood sugar control. Here's what evidence and clinical guidelines recommend for effective prediabetes prevention. 1. Maintain a healthy weight. Carrying excess fat, especially around the abdomen, is the strongest predictor of insulin resistance. Losing even 5% to 7% of body weight can dramatically reduce your diabetes risk. 2. Engage in regular physical activity. Aim for at least 150 minutes per week of moderate intensity exercise such as walking, swimming, or cycling. Physical activity improves insulin sensitivity and helps with weight control. 3. Adopt a balanced, low-glycemic diet. Focus on whole grains, fresh vegetables, lean proteins, legumes, and healthy fats. Minimize sugary drinks, processed snacks, and refined carbohydrates. The Mediterranean and DASH diets are scientifically backed for preventing diabetes. 4. Avoid smoking and limit alcohol. Smoking worsens insulin resistance, while excessive alcohol adds empty calories and disrupts glucose metabolism. 5. Manage stress. Chronic stress elevates cortisol, which negatively impacts blood sugar regulation. Incorporating relaxation techniques like deep breathing, yoga, or meditation can support prevention. 6. Regular screening and health checks. Get blood sugar tests, FPG, OGTT, HbA1c, as recommended, especially if you are over 45 or have risk factors like obesity, family history, or sedentary habits. The best time to prevent prediabetes is before it starts, not after the diagnosis. Your future health is built on today's small choices. Move more. Eat real food. Manage your stress. And never skip routine screening. Prevention isn't complicated, but it does require action. Start with one change today and protect yourself from diabetes tomorrow. Emerging trend insights in prediabetes management. Did you know that managing prediabetes is no longer limited to traditional diet and exercise advice? Thanks to rapid advancements in medical technology and lifestyle science, new trends are reshaping how prediabetes is detected, monitored, and even reversed, offering hope to millions at risk. Here are some of the most exciting and promising trends. 1. Wearable technology for continuous monitoring. Devices like continuous glucose monitors, CGMs, once reserved for diabetics, are now being used by health-conscious individuals, including those with prediabetes, to track blood sugar in real time. Imagine a 38-year-old office worker using a CGM discovered her glucose spiked after healthy, oatmeal breakfasts. By switching to eggs and vegetables, her daily glucose levels stabilized, reducing her risk of progression to type 2 diabetes. 2. Personalized nutrition based on gut microbiome analysis. New research shows that your gut bacteria influence how your body responds to sugar and carbs. Personalized diet plans, guided by microbiome testing kits, are helping prediabetic individuals choose foods that best support their unique metabolism. When a clinical trial participant learned that tomatoes, thought to be harmless, caused unexpected glucose spikes in her body, prompting a personalized diet adjustment that reduced her post-meal sugar surges. 3. Digital health coaching and AI-driven apps. AI-powered health apps offer daily reminders, meal suggestions, and exercise tracking tailored to an individual's risk profile. These apps improve adherence to lifestyle changes far better than generalized advice. This is how a middle-aged man with prediabetes used an AI-driven app that flagged sedentary days and suggested quick home workouts, keeping him active even during a busy travel schedule, preventing weight gain and improving his HbA1c levels. 4. Pharmacological innovation. New medications such as GLP-1 receptor agonists like semaglutide, originally developed for diabetes and obesity, are showing promise in preventing the onset of type 2 diabetes in high-risk prediabetic patients, alongside lifestyle changes. 5. Workplace wellness programs. Companies worldwide are investing in employee health through structured prediabetes interventions, offering gym memberships, on-site screenings, and dietary counseling, reducing healthcare costs and improving workforce well-being. Like a tech firm in California introduced a voluntary prediabetes prevention program. Within a year, 60% of at-risk employees improved their weight and glucose profiles, lowering their collective risk for type 2 diabetes. These emerging trends signal a shift from reactive care to proactive, personalized prevention, empowering individuals to manage their prediabetes risk like never before. The future of prediabetes prevention is already here, and it's personal. Whether it's wearing a glucose sensor, tailoring your meals to your gut bacteria, or using smart apps for daily guidance, new tools make prevention easier and more effective than ever. Stay informed, embrace technology, and take charge of your health today. Prediabetes is not the end of the road, it's a critical warning sign and, more importantly, a window of opportunity. While this condition affects millions globally, its progression to type 2 diabetes is neither inevitable nor irreversible. With the right knowledge, timely screening, consistent lifestyle changes, and modern tools, you can take full control of your health trajectory. Remember, the silent nature of prediabetes is its greatest danger, but also its greatest gift. Why? Because you have the power to intervene before permanent damage is done. Don't wait for symptoms to speak for your health. Take charge today. Schedule a simple blood sugar test. Evaluate your diet, move more, and seek support where needed. Every small decision you make now shapes your future well-being. The best time to prevent diabetes is before it begins, and that time is now. If you found this information valuable, don't forget to like this video and subscribe to our channel for more evidence-based health insights that empower you to take control of your well-being. Have questions about prediabetes or your personal risk? Drop them in the comments section. And remember to share this video with family and friends. You could help someone take the first step toward preventing diabetes today.